Okay, when you might use this, so you might use this in a patient or a client or a player where you pick up, the hip isn't actually symptomatic, but it's stiffer than it should be for their age. So maybe someone who does a lot of running, football, rugby, dance, whatever. So you pick up that they've got quite a stiff hip. It's not really symptomatic. You're thinking is that your rationale is that in order to do the activity you're doing, it would be better if they had maybe had more movement and then more control in that hip. And to get more movement in the hip, this is quite useful to do. So that's kind of one group. Second group is maybe someone who's had like a soft tissue issue here, settled down, but they've been left with some restriction in that hip. So that's probably the kind of younger patient group, kind of more sporty. Other group is the kind of the early degenerative hips. That bit of an older hip, so you're trying to maximise the kind of movement in it initially.
You don't find it useful for painful hip?
Oh yeah, sorry, yeah. And with those last two groups, obviously to maybe help clear that pain through movement. Couple of ways you can do this. Show you both. You can decide what works for you. So you're going to kind of position, they can position the belt kind of in the groin. And then the belt is going to kind of sit just kind of below your kind of bottom. So you're going to kind of sit into it. You can either have this hand inside the belt, which I think gives you a lot more control and localises the movement a lot more, or you can have it outside. But try with both and see what, and there is quite a difference. So see what you think. So we'll maybe have this up a little bit. So I'm going to get my left hand in around that kind of iliac, just below that iliac crest. Going to do it. So I'm going to come in like that. So in order to get that, you need to be standing away a little bit. So this is below kind of ischial tuberosities. Come in here, and you're going to hook your elbow into your ASIS. So this arm's kind of parallel to the ground. So come in like that. Then you can tighten the belt up and lift a bit. So I'm going to tighten this up just a bit. Then we'll say that it's maybe flexion is either limited or painful, but probably maybe towards the last part of that range, or it might be that medial rotation is limited. So our starting point is maybe 90 degrees. Okay with that? Do you want to drop your head down? Do you want another pillow?
No, it's okay.
So we're going to come inside the belt. I'm going to just cradle that. So this hip feels supported, and I'm trying to keep it in midline so it's not out, it's not going to drop out here. So I'm going to stand nice and tall, I'm going to drop my hips out, which is the glide. So hips, my hips give the glide. Okay? That's all I'm doing at the minute. It's working at that glide. Now it's comfortable. It's not compressing it. It shouldn't be. Okay. Then why don't we get you to bring your knee to chest? So you're going to kind of move with this. Back. And again. And again. And again. So you kind of going back to front foot. If you're doing rotation, you're going to need to kind of guide that, because otherwise, if you allow them to rotate another, they'll probably do a combination of movements. So what we're going to get you to do is we're going to get you to bring your foot out a little bit. Okay? Just going to get you to do that in a minute. And away you go. So I'm going to move around with that. Okay? Okay. Now, this tends to be quite good for loosening up these hips. I don't think it's much to do with the glide, really. I think it's possibly you are... It's hard to get a glide at the hip. It's a very deep, powerful joint with a big, thick caps around it. What you are probably doing is localising the movement and making it move in maybe a more pain-free way. And also you're getting it probably moving in those, not pure planes, but you may be moving it more in the restricted plane, particularly with rotation. So, but it does seem to be quite useful to get a lot of movement back, either at these asymptomatic stiff hips, these hips that are painful in movement, or these degenerative stiff or post soft tissue stiffness. How many of you use this for hips? So that's quite a few. So what do you use?
So normally we'd have the patient just to twist his torso. And it doesn't matter, it depends on if internal rotation is limited or external rotation. To the other side.
That looks good, guys.
And usually combine it in a lunge position, it's quite difficult.
Just because you speak doesn't mean you've got to demonstrate. Has anyone found anything else that's useful, and maybe another use for this that we haven't mentioned around the hip?
It's very similar to that functional. Do you remember the guy you had here for a day when we did functional rehab?
Yeah, Neil.
Yeah, it's very similar to his philosophy on the 5 different ways you can get a joint to move. So you might want to get the knee to come in as you go like that, or you might want to get the body to twist like that. It's the same movement,
right?
But it's a different way to engage it and bring it on, and obviously you can get your hands on to do that as well. So it's quite.
Yeah, I think there's a lot of links between that.
It's good to follow up as this is your treatment, as this is a home exercise.
Because you can kind of, and you can guide it possibly. Okay.
This one, and then squat. Double squat. Try the squat. Okay. It's a flexion. You can use it also for lunge. If you want to do rotation, want to improve rotation, you'll give him rotation variation. You're pulling it laterally while he's doing this.
Do you want to do rotation?
Yeah, it's usually
Rotate towards the hip joint, and then bring it back up, and then just give it a little bit of a distractive glide like this, and just take it against each other, or sometimes sit back into it a bit more, and then go back into the movement, and often it's a better movement.
Right, it's probably getting quite a nice stretch out of it as well, like. Awesome. Thank you for that.